have often been told by caregivers that they don't know what they would have done had we not been here. And I don't know either.
Caregiving is a 24-hour, 7-day-a-week job, and there are multiple studies that have shown the effects of caregiver stress. Fortunately, it ends up being where the caregiver becomes sick, and at that point, they're in need of a caregiver.
You can't be behind a closed door here. You can't disappear, you can't be invisible. When you're here, something's gonna happen. When you drop your loved one off, your loved one is not gonna sit in a corner unnoticed. Someone's gonna grab his or her hand, and he or she is gonna be dancing or painting or doing something, even if it's just watching from the periphery because that's all your loved one feels comfortable with. Something's gonna happen. My caregiving journey for my mother began almost 9 years ago. It was when she had her first Parkinson's-related fall that led to a badly broken leg bone and a long period in skilled nursing that things began to change drastically. Her particular disease requires specific medications at specific times, as the Parkinson's Foundation says, on time, every time. And there are no licensed medical facilities that I know of, other than an adult daycare program, that will give medication at specific times as prescribed. My mother is here during the day when there's a noon dosage, and she gets that medication every day at 12 p.m. When she was in assisted living, that medication might have come at 11 a.m., might have come as late as 1 p.m. Multiply that by 3 or 4 doses a day, and what you have is a really rocky road. To imagine that my mother comes to a place where there's not just one activity calendar, and it's not just an activity calendar that looks pretty, it's one that's actually implemented. People show up for the activities. There are 4 or 5 of them taking place simultaneously in this one facility. There's a young adult group, there's a middle-aged group, there's my mother's seniors group. At any time she wants to cross the boundaries and go participate in one of those activities, she does. She's 87 years old, riding a stationary bicycle and playing a ball game with people who are much, much younger than she is. There is not a medical facility in town that would let her do that, except for a place like this. She's doing remarkably well, and it wouldn't be possible if I were trying to care for her 24 hours a day, 7 days a week. It wouldn't be happening if she were in a round-the-clock care facility. It only happens because we're partnering in this process.
We have 3 ways of communication here: telephone, telegram, and tell Courtney. I got bullied so much because of the CP, so it was just hard going to school. I would just eat lunch by myself just to avoid getting bullied. Finally being accepted for who I am, knowing that there's other people out there that have the same stuff, and it's actually been amazing because my attitude has been improved a lot, just having friends my own age to talk with and just to get out of the house and hang out with them for the day.
There's a lot of inspiration here, and you don't have to look hard to find it.
And I felt like it was really a safe place, and I think that was the most important thing for me, was that it was safe and that he would feel welcomed. And honestly, I don't know if there's any other daycare programs, because I was so satisfied with what I found here that I said I'm not going to look anywhere else.
When a client first comes in the door, we evaluate both the caregiver and the client for what their needs are, because they come in together with both have needs. And we try to fit in, are they going to need funding help with this? What we try to do is not let them go out the door without some kind of options to come here.
I guess unfortunately I still have to work, and we still have bills to pay and things like that. So it's a lifesaver, it really is.
Always, I wake up every morning saying I'm grateful I have these people that care about me. And
He went from being in a wheelchair to a walker, and now he doesn't need any assisted devices.
There's no solution to getting old. That's the hard part. And I think most people, family caregivers and their loved ones, are running from that reality, but we're not running from that here. My mother has lived 3 good years because of FSL and I partnering. And there's no doubt about it. She wouldn't be alive today if it weren't for that.